All right, everybody. So let's begin. Let's start going through everything here and really making sure that everybody is comfortable. What I'm going to do is I'm going to introduce, as I said, the schedule, and we will be pausing in between and taking some time to address some questions. And then we'll talk about questions that are already rolling in. We'll address them as we get to that particular section. So if you can, try and understand that I'm not avoiding your questions as we're going through this, but I will save them to the end. So the first thing that I want to start is very fundamental. The first step in getting started is making sure that you can log in, you can access the marketplace, and in order to do that, I want to go through some quick troubleshooting tools. Now, I know that Mr. Falco has sent out videos that you guys should all be accessing. These videos are on the YouTube channel. He's going to be talking about the direct link from healthcare.gov through Blue Cross, the application process, as well as SkillSoft training. If you haven't done them already, it is very important that you get that done, get it completed. Those are foundation and fundamental areas that need to be, and I am honestly not going to spend a lot of time on that. That is something that you guys have to take ownership of and really get through and do that. So the first thing I want to do is really talk about the major troubleshooting that people are having. So when you get into Blue Cross Blue Shield, you log into the Florida Blue website. That's first step. You have to be able to do that. What we're going to really be doing is identifying the area that you're going to access, which is going to be the health marketplace. Now, when you click on this health marketplace and go to marketplace, what's going to happen is a pop-up window is going to open. Now, you must be using a Firefox browser or Chrome. This is not going to work if you are using a Internet Explorer browser or other browsers. There are bugs with the other browsers, so if you're having issues and you're having a problem, then you are not using the right browser selection. So what's going to happen is you're going to get here, and then what's going to see is you are going to see your username populated here. Now that username populated here is the same username and password combination that you have when you access the CMS portal. So if you are trying to log in and doing an application direct from the Blue Cross Direct link, and what's happening is when you put your password in here, for example, you get a screen that looks like this. Well, that means that your username and password combination is incorrect. At that point, you are going to go to the CMS portal. You are going to log in here and make sure that you also can log into this portal. So if you cannot log into this portal, that means your username and password combination is incorrect. Also, your password must be reset every 60 days. So if you were able to get in and then you wake up in the morning and you're doing an application and all of a sudden, boom, you can't get in, well, that's because your password is probably outdated. The next thing that you want to check if you're having a problem in troubleshooting your access to the government website is make sure that you have a role identified in here and view and manage my access. If you don't have the federal facilitated marketplace, if it doesn't look like my screen looks right now, well, then that means you've done something wrong or you've never completed your application for the marketplace. So please make sure that you do that. Those are keys. Those are real simple steps that you can take in order to make sure that that's working. So what you can do is you can make sure that that's working, access that. If you don't see this right here or you can't get into these systems, that's because the username and password combination you're using is incorrect. So what happens if you put if the improper username is constantly being populated? Well, what you're going to do at that point is you're going to have to go into Blue Cross, and what you're going to do is you're going to get to Gorman. And right here where it says certification process, this is the area that you would log in order to change that password combination. And let me see if I remember mine. I might not. Let's try again. You click forgot password. It will send over your password to you. Then you would log in. Then you would change that password and username, the username that's represented in Gorman. And I know this gets a little confusing. So what's going to happen is if that is incorrect, And when you are in the direct link from Blue Cross and you come in here and I click on my White House, when I click on Go to Marketplace, if that is not correct and the username is not the username that is located in here, then you have to go and log into Gorman. And that Gorman access is in Sales and Training Support Materials. Go to the Marketplace here. You would then put in your username and password. If you don't know your username and password, click Forgot Password. Now, there is a video that goes through updating that, and that is in direct link from Florida Blue. It's right here. So I'm not going to spend time and go through that. In your username, someone's saying on Gorman is your social, unless you changed it. You can change your social security number and represent a different username. The username and the issue that people are having is that they think that the username for Gorman is what is represented in the process of the direct link, and it has nothing to do with it. What you have to understand is that your username and password, that is a combination here, when you are on the CMS portal, now that is the username and password combination that you are going to be accessing when you are on that direct link from Florida Blue. All right. So now some people are asking some questions. So you change that username and password here, and then you make sure that it's represented correctly, and you change your username only in the Blue Cross Blue Shield website. Okay? So that's the basic 101. If you are having problems with that, you're going to need to contact the portal. You can make sure that it's in here. We've also identified some other issues where people have not completed their Medicare Learning Network certifications correctly. Now, what happens here is that if you have not inputted your national producer number at the beginning of your training, so in other words, when you did this and you clicked create an account and you went through all these questions, if you did not put your national producer number in here, the right national producer number at this stage of the game, when you created the account, you are going to have to redo all of your testing. So if you're having that issue and you're having multiple issues, you have to think back to when you originally did this certification, and if you incorrectly put in your national producer number, if you put your Florida Blue writing number, if you put some other number, if you put your tax ID number or your social, well, that's incorrect. And you will have to do your testing and certification over again. So those are the basic 101 areas that people are having the most problems with when they're coming to getting in here, clicking on the Go to Marketplace, and they're not able to gain access into the healthcare.gov. Because it should be really simple, and this is how it goes. I would click on Go to Marketplace. It opens up that handy-dandy pop-up window. You have to make sure that you have that. You type in your password here. You click Login, and now you can begin. So it's very important that you can get to this section. So what I want to do right now is just pause, address some of the questions that have come through, and make sure that I answer any other additional questions that are related to the simple steps of accessing the marketplace through the direct link, all of which, just to remind you, have been covered on our multiple videos that I know Mr. Falco has sent out to you. So newly added on the lookup screen from the direct link is the ability to look up with a client's marketplace identification number. So if you've already completed one of these applications, you can put that application identification number in the screen along with all of their pertinent information that you did when you had already created this. And this is for someone who has had already gone through the process of determining a subsidy. If not, then what you would do is you would start this process or start an application. Now you can click start an application after you select the state. Obviously we're going to be doing Florida, and then we could simply go start an application, but they are also going to, for smoothness sake, you are going to want to go through and you're going to want to fill this information out. Okay, now the email address, even though it says it's optional, I would suggest that everyone has that email address on there. And then you would put in your date of birth. And social security number is going to say it's optional, but once we click start application, it's going to then begin to start our application. Now this is very, very basic, okay? One thing I want to tell everybody is what you need to do is slow down and read what's on the screen. It has never been more important than ever for you as an insurance agent to read the application, because your answers are going to drive the subsidy determination. Now, when you're going through this application process, you are just going to answer the questions accordingly. And as you're answering those questions, you have to be conscious. Does the question say applying for coverage, or are they asking you questions about the family household? Also, when we're talking about what qualifies, as we go through some of the rules that we're going to cover a little later on in this training, that you will have to make sure that you understand the rules. Because if you are not understanding what the rules of healthcare reform are and the basics of what qualifies for a subsidy and what does not, well, you're going to be giving out bad advice, you're going to be frustrated, and additionally, you're going to be telling people that they qualify for a subsidy when they don't. So what we're going to need is some basic demographic information. You're going to go through this. You're going to answer the questions. Pay attention. Take your time. Now, when you're doing this process, you have really two choices. You can either be doing a Join Me, which is a web sharing program. You could be using a GoToMeeting, very similar that we're using now. But what you need to do is you cannot be completing this on the behalf of your client without material knowledge of this application. It is a complete violation for you to say, oh, let me get all of your information, Miss Crystal, and I'll just fill this out for you. No. It's not going to work that way. They have to have material knowledge of this application. You must be using a web share program or be sitting with the client. Otherwise, you're opening yourself up to a violation. So make sure you know how to use and access Join Me. Those of you that are not familiar with the Join Me program, shockingly enough, we've got some training on that on our YouTube channel. The Join Me program is a free service that you can utilize. There are also several other options that you can utilize as well, but Join Me is really the direction where you want to go. You won't have to pay for it. It's very simple. Define material knowledge is the question. Material knowledge means they need to be with you. They need to be looking at this screen. Okay? The agent can type. The person can watch. The person can be part of the process. You can be inputting all of the information, but you can't be doing it at arm's length. Okay, it is very dangerous because if a subsidy is determined incorrectly, then at that point in time, they're going to look back to you as the agent saying, I didn't tell them my income was that. That's not how it works. That's not how I want it. And because now we're dealing with the IRS, because now we're dealing with other governmental entities besides the IOR and the insurance department, we need to make sure that we're doing it properly and appropriately. So they can come into your office. They can sit with you on a Join Me. They can access a Join Me from their smartphone. They can access a Join Me from an application that they can download onto their iPad. Most people have a smartphone or have some way of watching and doing this, and that is always an option. Now, there is a paper application that they can fill out, which that you can utilize as a fact finder if you needed to send it to your client that they could sign off on. That is an option. However, again, this process of determining the subsidy is very important that they have full disclosure. They know exactly what's going on. I'm spending so much time on this because it's so important. You can't be sitting in your office just getting someone on the phone and typing all the information in. That's going to be a recipe for disaster. So now, I'm not going to go through every screen on this. We all have very busy days. You need to go and do one on yourself. Do one on a friend or a family member. You can go to the YouTube channel and watch the application that I've already gone through and done. Those of you that have already gone through the Florida Blue application process, the only difference that you're going to see in this process that I've created here for you guys to watch and what we're currently dealing with is the fact that we are using Social Security numbers. So now you are going to want to use Social Security numbers. When this was released, Social Security numbers were hanging up the system and making sure that they were getting hung up because of the communication between the IRS and the Department of Homeland Security, so on and so forth. So if you haven't gone through this, watch this or do one on yourself. Okay? So let's take a pause. All right, let's move on now. So let's talk a little bit now, some other details I want to go through. Understanding healthcare reform. Really want to talk a little bit about some basic qualifications, and this is Healthcare Reform 101. We want to make sure that everybody understands that there are certain qualification factors that are coming for income, that we have to be within 100 to 400% of the federal poverty level. And you have to make sure that you understand buying on and off the exchange, and there's value for both of those. You want to call it the marketplace or the exchange. You can call it anything that you want. You just don't want to call it Obamacare. Now, as you're going through, we're also going to cover the basic plans, network variations, and some of the reasons for you to be offering Florida Blue and the value of offering Florida Blue. So as we're going to talk a little bit about who's going to qualify for help and what we're talking about. Remember, what are the reasons that the Healthcare Reform Act and who it's going to help? It's not going to help everybody. Trust me, you're going to talk to people who are upset, people who don't want the Affordable Care Act, they don't want anything to do with Obamacare, they can't stand the president, they hate the government, they do all of that stuff. Well, that's fine. But it is going to help a significant number of people, and you need to understand who those people are, how to identify those people, and what you're going to talk with them about. So the first thing is our uninsurable community. As you know, that there are a ton of people out there that are finding it hard to find insurance. Well, that's what this act was designed for. And remember, it's a law. This is not just something that somebody came up with that we've all been dealing with. This is a law. So the uninsurable folks now will be able to get insurance, get a quality insurance policy. And is it going to be inexpensive? Well, not for everybody. It's only going to be inexpensive for those folks that are between 100 and 400% of the federal poverty level. Because other than those people, the Affordable Care Act is a lot of things, but it's not affordable. Also, the underinsured. People have bought a B-rate insurance program, a limited benefit program, or some other company that's giving them lackluster benefits. Well, this act is also going to help those folks, and you need to be able to have that conversation. Children. Now, for all the kids, one of the things that we did lose out for in the past couple of years was the ability to write child-only policies. There are a lot of people out there that care a lot more about themselves than they do about their then they care a lot more about their children than they do about themselves. Sorry, I need more coffee apparently. And they may not want to take insurance for them, but they want top quality insurance for their kids. Well, we can write child-only policies, and you want to make sure that you're able to talk about those child-only policies because they're not expensive. And with the guaranteed issue provision, if those folks have high ratings, or the child may have special needs, autism, and different things like that, they can get an insurance policy. That policy will be the same rate for every child that's out there at their particular age, so you want to be able to utilize that. Also, overpriced group insurance. A lot of times, because one of the disqualifying factors is going to be to get a subsidy, do you have health insurance coverage through an employer? Well, many a times, if you're talking to someone who has a single child, that single child group insurance will be more expensive. Because remember, they're charging you the same price for one child or 10 children on a group insurance policy. And that child, if there's only one kid in that household, then they would be better off taking a healthcare reform plan without a subsidy than adding them to a group insurance policy. So we've already covered the registration with the marketplace, the CMS portal, and uploading your certificates, and you're always going to register and get that all completed. Next step is understanding the tools and the rules. So if you are giving people the wrong advice, if you don't understand the basics, you're never going to sell a single Affordable Care Act plan. And you don't have to understand the federal poverty level. You have to understand estimating of a subsidy, how group insurance is going to be affected with healthcare reform, and also making sure that you have the proper logins and access written down and you are able to direct your clients in the appropriate manner. Now, we've covered all of these things before in other trainings located on the YouTube training channel. You need to make sure that you understand that, and we also have to make sure that we understand the networks. Now, Florida Blue is the premier carrier in the state of Florida, the only carrier that's offering health insurance in every county in the state. You need to understand that we have 3 different networks that are available, and the benefits aren't going to change amongst those networks, but what is going to change is the doctors that they can seek. But the benefit structure is going to remain the same. And you have to make sure that you can effectively use the provider directory. If you are not efficient at using the provider directory, and many of you that are on this call have sold a lot of Medicare policies this year, and you obviously, working with Medicare beneficiaries have to be very well versed in utilizing the provider directory. And with that scenario, you're going to do the same thing in the healthcare reform world. So the first thing we need to understand is that we have 3 different networks. We're going to have our Blue Options network, our Blue Care network, and our Blue Select network. Now, all plans are available on all networks, have the same benefits. There is going to be a significant price variation between Blue Options and Blue Select, upwards of 25% in many cases. Now, with our Blue Select, let's start with the green and move up to the Blue Options. The Blue Select policies are going to have a smaller network. Some people refer to that as an EPO. A smaller network of physicians, but a lower cost basis on a monthly premium. It is a PPO non-referral network with the same coverage outside the state of Florida as in the state of Florida. Balanced billing protection on our Blue Select programs, and what that will mean is that they can take that Blue Select policy and they can go out of the state, and they will also be able to get in-network treatment if they're out of the state, as long as that doctor selects and takes Blue Cross of their appropriate state. By looking at the provider directory, you will be able to identify out-of-state providers as well, and worldwide. Blue Care is our HMO. The HMO does not require referrals, but it is a large network of physicians. 97% of all our primary care doctors take the Blue Care network. The numbers are about 76% of all our specialists take our Blue Care network as well. But again, you want to be conscious of the Blue Care network, Blue Select network, and searching for the physicians. Blue Options is our largest network. It's going to have the highest cost basis. Balanced billing protection also on our Blue Options. The availability to have the largest network and do traveling. Okay. Now, the Blue Options, we've covered all of this already. I'm just going to zip right through that. The Blue Options is available in all counties in the state. It is going to have the Blue Card program available for you. That Blue Card program is the program that allows us to go to other states and get that in-network treatment. It is going to be the highest cost, saving you about 5 to 10% depending it's going to be about 5 to 10% higher than the Blue Select. What's going to happen there is our second largest network. It's HMO with no referrals. The service from Blue Cross anywhere in the state, so there's no closed networks. It's not going to be like a Medicare program for some other companies. We actually don't even really call it an HMO. It's just the network. Okay. So as we're looking at the emergency care as well as out-of-area dialysis and urgently needed care, just like with a Medicare program, is also covered worldwide. It's available on all of our healthcare reform plans, but there is no balanced billing protection. So there is no balanced billing protection on the Blue Care programs. The slide that you see in front of you is the listing of the counties that Blue Care is available in. Blue Care is not available in all counties, but it is available in the counties that you see here. Our Blue Select is the lowest price plan, as we're dealing with a lot of lower income individuals, as people that are going to be closer to that 100% of the federal poverty level. They're not accustomed to having that large choice because if they've been on the Medicaid program or a governmental issued plan, then they're not accustomed to the large networks of the Florida Blue options. So don't be afraid to look at the Blue Select. Be really conscious about the Blue Select, though, because just to give you an example, we don't have the doctor participation in Blue Select that we have in Blue Options or Blue Care. And it'll bite you in the behind really quickly if you don't manage the expectations of your client. You need to check the hospitals that are local. You need to check the doctors that they want to use. And if you don't do that, you could be causing yourself a lot of grief. Because remember, once they buy a healthcare reform policy, they're not buying another one until next open enrollment. This is just like Medicare. So you have to be conscious of that because you can't just be changing mid-year. I can't switch from my Blue Select to my Blue Options because my doctor doesn't take Blue Select. You have to do your due diligence to make sure that your doctor is in network. Now, Blue Select does give us the ability to go out of the state and get elective care and be treated as in-network. So you do have that flexibility. However, you don't have that flexibility in the state of Florida because you will be treated as out of network if you go to a non-Blue Select provider. It's a little backwards and it doesn't sound right, but what you can do is you are not able to utilize this to that same capacity. Okay, so the Blue Select counties you see on your screen right now. I know that Gigi has sent out these counties of availability. We will also make this available in our Dropbox programs and other training materials that we have available. But this recording as well will be available for you on the YouTube training channel. So making sure that you're using the networks is really the big selling point when you're talking about Florida Blue for 2014. So you want to make sure that you're talking about the network, making sure that you're managing the costs and make sure that you're looking at the benefits. Because what you're going to be able to see as you start playing with this is that I could get someone who's looking at a Blue Options Bronze program, and I could get them all the way up to an all copay plan if I go to a Blue Select from a Blue Options. There is such a cost variance if that person lives in a state and has that, a county that has that Blue Select, Blue Options. You want to make sure that you're identifying that. Also, sell the networks, and you have to take the time to sell the networks because the networks are really important for you to take the time about because of the cost variations. Talk about elective care. Talk about their management of travel concerns and where they'd want to get the elective care. The network conversation and the significant savings is a conversation that you can have just like you would have with your Medicare clients. Now, what is the competition doing? What are we up against? Well, this is where we are going to kill everyone, excuse the expression, but where we're really going to be leaps and bounds over the competition. As I've already stated several times, we're the only provider that is offering a qualified health plan with a subsidy available in the entire state of Florida. Additionally, there are 35 counties that we are the only provider for health insurance. Now, what are the other companies doing? They're doing a gatekeeper program. They're doing a small HMO network. They're moving to these smaller networks because that's the only way that they can stay competitive in the marketplace. Many of you know Blue Cross is not historically known for having the least expensive policy. We've been wildly successful over the years knowing that and understanding that. What we need to do is take the time to sell Blue Cross, sell the network, and the flexibility. You are going to come up against people who don't care about the network. They don't care. They have 2 doctors in their area. It doesn't matter to them. They have a 45-minute drive to their hospital. It doesn't matter to them. And those people are not going to be a Blue Cross client. If I can use South Florida, for example, Miami. In Miami, the marketplace in Miami is very difficult because there are some small networks that are there that are very closed, okay, especially in the Latin markets down there. And a lot of those folks don't see the value of being able to go to Jacksonville or go to a different hospital or have that flexibility. They're happy with their 3 doctors. They are very happy to save themselves $5 a month because that's not important to them. You really don't want to rack your brain saying, what am I doing wrong? Some of that mindset just can't be changed. So the pricing and benefits are altered based on income and qualifications. You do need to understand that. What you need to understand is that anyone that's under 250% of the federal poverty level is going to get a price variation, as you know, in the form of a subsidy. Additionally, they are going to get a cost-sharing variation, which is going to give them lower deductibles, lower copays, and a better plan. You need to understand these basic concepts because you're going to have clients that are buying the same plan but have different cost variations. Because somebody may have a silver plan, number 1498, for example, and they have 1498 A, B, or C. And based on their income, one person may have a $750 deductible while the other has a $5,000. We're really only going to have 5 styles of plans that you're going to have to deal with. We're only selling 4 of those for the most part. You have this. Everyone should have a copy of this. This is the roadmap of a good understanding of the plans. If we start from the bottom and we work our way up, the first thing I want to tell you is catastrophic plans you make no commission on. I know that nobody on this call is driven by commission, but catastrophic plans, as you know it, are only available to people that are 30 or under. And with 30 or under, or they need to show a significant financial burden in order to get or be having a better policy. We're going to have bronze, silver, gold, and platinum, and we are the only company offering the platinum programs in all of the counties as well. And we have 2 platinum, we are going to have 3 gold, and then we can see all of the silver plans we have as well as 3 bronze. And each one of those plans has a cost variation based upon the network, Blue Select, Blue Care, and Blue Options. And then you see the deductible options that are here. However, if you get into a situation where you're talking to someone that's under 250% of the federal poverty level, not all plans will be represented. And instead of having a $5,000 deductible, you may be looking at a $750. So as we move on, let's talk a little bit more specifically about the plans. And this is kind of a good roadmap for you to kind of understand what's going to be available on different metal levels. Platinum, we have an all copay plan and an everyday health. Great for folks that need a lot of medical attention, can afford, and want a high-quality plan. The gold plans as a base policy are going to have a variable of deductibles and also opportunity on the silver to have an HSA, an essential plan, an everyday plan, and then bronze we have our HSAs and an everyday health. Now we are going to talk a little bit about Skillsoft as we get a little bit further in today, and then you guys can go through all these plans in a lot more detail. Now, the value-added RX for chronic conditions is going to be available on all of our plans. There's one HSA that it's not available on. And with that, what you need to understand is that we will be providing zero-cost mail-order generic medications for chronic conditions. And if they need to fill those medications at a retail pharmacy, they would be $4. As well, we will provide half-price brand name drugs when they are related to preventative medication, all of which are not subject to deductible. Now, we are also going to be installing some special value-added programs for chronic conditions, and these programs are designed for people with diabetes, asthma, depression, high blood pressure, and high cholesterol. Those are going to include your lab tests, which are going to be free, your preventative screenings as well. Those are all part of qualified health plans on the preventative screenings. The lab tests is going to be at no cost, and that's going to be for wellness or sickness. As you should all know already, we use Quest Diagnostics. Now, with many of our plans, we get the 3 visits. First visits are going to be free on many of our plans. So that means that if I go to the primary care doctor, I have 3 visits for free for sickness. Plus, I have 1 visit for free if I'm a man for wellness, 2 visits if I'm a female. Females are going to get an adult wellness program and an adult female wellness. So make sure that you're talking about the generic medications. Make sure you're talking about the diabetic medications, because we also have special programs that are designed for those diabetics. Self-management programs, insulin pumps covered under durable medical equipment, the way that we cover syringes, and more of those details are all covered within the SkillSoft training. Really, with the maintenance drugs being at a zero copay for your generics by mail, or $4 not subject to the deductible, is probably one of the biggest selling points that you want to focus on, because the competition is not doing this. Remember that in the world of healthcare reform, everything that comes out of pocket goes towards your max out of pocket. That's going to be for medications, and that's going to be for doctor visits. All of those medical costs are going to apply towards the max out of pocket on our plans, which is very different the way that the world used to operate and the way that Medicare operates. As all of you know that sell Medicare, we have our Part D, and we have our prescriptions that are treated separately from our medical. Well, with healthcare reform, it's not like that. Everything is going into one big pot. So this is a pretty colorful screen. I apologize for all the colors. It just kind of worked out that way, but it's kind of funny. So what I'm going to do is go through some of the bronze plans first really quickly. Again, you're going to want to reference the SkillSoft training for more detailed training on the particular plans. We have an everyday health plan, and we have an essential HSA. If you're looking for the lowest cost plan, then you're going to really want to look at that essential HSA. However, in cost variables or variations, when someone is under 250% of the federal poverty level, this HSA plan will not be an option. It will disappear. Now, with our everyday health plan, this is going to be one of the more popular plans that you're going to see. It is good for someone who needs basic maintenance but is not running to the doctor all the time. So it's going to give you the first 3 PCP visits at 0. That is per person on the policy. Everybody's going to get their wellness, and then a $40 after that for your primary. Specialist is going to have a copay as well. Additionally, on the everyday health plans, it's going to come with a $6,000 deductible, doctor visit copays, prescription coverage. Everything else outside of the doctor, the specialist, or the primary care is going to be subject to the deductible. Now, with our essential HSA plans, they are the lowest premium. It's your client is going to get the negotiated rate for all of the medical services. They are going to get their free checkups and wellness underneath qualified health plans and the core benefits that you guys should already know about. And with that HSA, once they satisfy their deductible, they would be covered for everything at 100%. Okay, they're good for healthy people, not somebody that's concerned with a lot of outpatient activities, MRIs, CAT scans, and things like that. It is for someone who is looking to manage the cost on a monthly basis. And we have many of our bronze plans in most locations are going to be available for our middle-aged folks in the 40s. You'll be able to find a lot of 0 premiums there. Silver plans, we've got a lot of different options. I have an arrow on the bottom that kind of illustrates how the cost of these plans go from essential all the way up to predictable cost. The essential HSA on a silver, how that becomes a silver, it's got a lower cost share variation because it's got a lower deductible. It's a typical HSA, no copays. Then we have our essential program that is only available on our, it's going to be starting to be available, on our silver policies, and that's going to be a $2,100 deductible. Everyday health, going to have a couple of variations on there. The everyday health programs, again, copays for specialists and primary care, but it doesn't have all the copays for things like MRIs, CAT scans, and things of that nature. Continuation on why you would sell these plans. If you're looking towards the essential, you're selling on the lower deductible over bronze. If you're selling on the essential standard plan, you're really going to be focused on the cost, and I don't really foresee that most of the essential plans are going to be very popular. Everyday health plans are something that is probably going to be our most popular selection. There's not a large cost variation between the essential and the everyday. Predictable cost, I usually advise that for kids. It's going to be copays for advanced imaging, copays for all your doctor visits. In addition to that, really it works like a 533 does today. Now, with our gold plans, we have essential, we have our everyday health, and our predictable cost. You're going to have a surgical copay on the predictable cost. Again, a lot of these details I'm kind of going over really quickly. I'm going to show you some cheat sheets, and I'm going to show you some other things when it comes to the plans, but I'm not really going to rip through all of the benefits, but really just understanding the basics. Notice that we're not talking about a lot of different plans. Okay, there's not like 40 or 50 different programs. It's really a selection of about 4 variables that you're going to want to really focus on. And then our platinum programs, obviously everyday health and all copay. These are going to be for those individuals who are sick. They know they're going to use their services. It has low deductibles, and then they have the all copay that has no deductibles, copays for everything. So how do you know what to pick? This is a very important slide here because these are some advised variables that you're going to be looking at. Healthy families with low to no subsidies. Then you're really going to want to look at the bronze programs. What that's going to do is if they're not going to have a lot of subsidy, it's going to take that everyday health plan, the 16, the 83, or the 49. And you really look at that plan. Now, if they're unhealthy and they're subsidized, well, always going to want to try and buy up to gold with a network if at all times you can. But if you stay in the silver, the predictable cost is a great policy for people, and you'll see the numbers here. If they're healthy but they get a high subsidy, you want to try and, again, always buy up if they can. But the silver everyday or predictable cost plan is really going to be your best option. The everyday health plan is where you'll find those lower costs. And then if they're unhealthy, no subsidy, you definitely want to get with that predictable cost plan. If they could afford it, obviously try and get to one of those all copay plans if at all possible. So just some variables there on probably some of the plans that you're really going to really be focused on is really going to be your essential HSAs. That's low cost. It's a lot for the money. You're definitely going to want to be adding ancillary benefits in the form of accident and critical illness, and make sure you're utilizing those tools as well. The everyday health, it's a great value and benefits and cost overall, but it does have some lacking there because you don't have the copay for the MRI, you don't have the copays for some of those services, but it is very appealing. It's good bang for your buck, so to speak. And then our predictable cost plans all around. It's our rich plan. A lot of us that have been working really hard, on the 533s, 34s, 35s. If you sold Blue Cross before, you know that there was only a handful of plans that we ever really talked about, and then there'd be some, obviously special, unique situations. And these plans that I've just talked about here are really going to be those core grouping of, 9 plans that you're going to kind of focus on. And know that the variables of 31, 98, 64, 86, 52 on the essentials, those are just network variables. Okay, some of the keys that you guys really need to understand is you don't want to overinsure anyone. Remember, they got to pay their premium payments. If they're not paying their premiums, you're going to get a chargeback or you're not going to get paid. So it's really important that you take the time to listen how they used it in the past, what's affordable. Don't overinsure them. Make sure that they're comfortable with your monthly payments. Make sure that you're not selecting a plan that they can't afford. You really need to embrace that network selection and be able to have a competent conversation with them about that. Manage the expectations of the performance of the policy is very important. You have to have your provider directory right at your fingertips. How is it going to work? Try and save them money. You're also going to want to have some cheat sheets that we're going to talk about as well. Well, the cutoffs, we've already really this has changed a little bit, but the cutoff is going to be the 23rd. December 23rd is the cutoff for you to get a 1/1 effective date. So after Monday, we're working on a 2/1 effective date. And after January the 16th, well, that'll be the cutoff for that date. So you really need to roll your sleeves up and get going. You also need to understand what their other options are. Short-term medical, an underwritten policy. These are all areas that are also very important that you need to make sure you're comfortable with. You have to tell the Florida Blue story that we live here. We only sell in Florida. We're the only carrier to offer coverage in the entire state of Florida. You're going to talk about those care management programs, the value of healthcare being built for our Florida residents. And really, I can't stress enough how we only sell to Florida residents. What's happening in Albuquerque, New Mexico has nothing to do with our policies, and we don't build them that way. Make sure you're talking about the free doctor visits, which a lot of the other carriers aren't doing. Also, the Value RX, zero cost, low cost programs with a high value, and talk about that blue card being able to travel and use the policies. Because the way that the other guys are selling against us is that they say, well, you're buying Florida Blue. Once you leave Florida, you have no coverage. I can tell you clearly that that's what the competition is doing. You want to make sure that you're comfortable with the IST, which we've gone through. Make sure that you know how to do the Join Me. Also, a Consumer Connect or Telephonic are also two other options. We want to making sure we're taking application for and payment with all of our applications. All right. So what happens if a client doesn't have a PC? You're going to have to roll up your sleeves and get with them, drive out to their house. Also, you can call healthcare.gov on a three-way call with you on the phone. Get them on the phone, get the client on the phone, and you could do a three-way conversation. Select the plan, get the subsidy, do the whole kit and caboodle, and make sure they get your national producer number so that way you get credit. You cannot do a paper application for a subsidized app. There are no paper applications available. What happens if the client doesn't want to give their income? Then they don't get a subsidy. Very simple. What they will do is they would get their subsidy at the end of the year when they file their taxes. Florida Blue will communicate that they had insurance. When they file their taxes, the IRS would give them any amount of subsidy that they should have gotten because remember, it was an advance premium tax credit. Can you show other carriers other than Blue Cross? The answer is no. You cannot sell any other carriers other than Blue Cross. It is a violation of the contract. You just have to write Florida Blue, which is easy to do in this marketplace. Very easy to do. What if the client doesn't want Blue Cross? Unfortunately, you're going to have to walk away from that business. Can they add a doctor to the network? Yes. The answer is yes. It's not easy to do, but that doctor can be added. I wouldn't promise it, but it is something that they have to meet certain qualifications in order to get that doctor added. So Blue Cross or the doctor, everybody's got to agree, and that way they can go. What happens if they want to change their plan? They cannot change their plan. There are no mid-year changes. It's a lock-in period, just like we have with our Medicare applications. So you cannot change that from one policy or one network or internally once that subsidy has been determined and applied to a particular plan. And what happens if they cancel mid-year? Well, if they cancel mid-year, then what's going to happen is, depending on the timing of that, you will either get a chargeback or you will just keep your commissions that you've gotten with no renewals. They are not able or eligible to enroll in another plan during a mid-year without a special election. and canceling their plan and not making their payment is not a special election. Okay, so let's take a little bit of a pause here and